Hello, dear friends. I'm about to share some powerful hemorrhoid secrets that will change your life. You see, I've uncovered hidden causes and surprising topical medications that most people overlook when it comes to hemorrhoids and anal itching. These aren't just typical health tips. They're game-changer steps that could help you finally find relief and prevent further discomfort. From everyday habits that are adding fuel to the fire, to overlooked lifestyle factors that could be making things worse, I'm going to reveal it all. Trust me, you'll want to stick around because the final tip could completely change how you think about itch relief. What are hemorrhoids? To understand the real cause behind that itchy, uncomfortable feeling, it's important to start by understanding what hemorrhoids are. Hemorrhoids, sometimes referred to as piles, are swollen veins located around the rectum or anus, similar to varicose veins. These can develop internally, inside the rectum, or externally, under the skin around the anus. While hemorrhoids are extremely common and affect millions of people worldwide, their symptoms can vary significantly depending on their type. Internal hemorrhoids typically develop inside the rectum and are usually painless. However, they can bleed if irritated, especially during bowel movements. This bleeding might be one of the only signs of internal hemorrhoids, and since they lack nerve endings, they rarely cause itching. External hemorrhoids, on the other hand, form under the skin around the anus and can be much more uncomfortable. Because this area has more nerve endings, external hemorrhoids often cause pain, swelling, and that infamous itching sensation. When the veins in this area become irritated, they can lead to inflammation, creating a constant feeling of discomfort that's hard to ignore. But why exactly does itching occur with hemorrhoids, especially with external ones? One reason is that inflammation around the anus can lead to swelling and increased sensitivity. As blood pools in the swollen veins, the tissue around them becomes tender and irritated, making even slight contact, like wiping after using the bathroom, a trigger for intense itching. Let's explore these triggers. Common triggers of anal itching. Beyond hemorrhoids themselves, certain habits and choices can actually make anal itching worse or even cause it in the first place. Let's go over some of the most common culprits so you can take steps to reduce this discomfort. Poor hygiene and irritants. Good hygiene is essential for managing hemorrhoid-related symptoms, especially itching. But there's a delicate balance here. Cleaning too little can allow irritants to remain on the skin, while cleaning too much or using harsh products can create irritation of its own. Many people make the mistake of using scented wipes or soaps, thinking these will help with cleanliness, when in fact the added fragrances and chemicals can aggravate sensitive skin around the anus. The skin in this area is particularly delicate, so any harsh wiping, rough toilet paper, or scented products can break down its natural barrier, causing itching and further inflammation. Dietary triggers. Did you know that the foods you eat might actually worsen itching and inflammation related to hemorrhoids? Some foods are known to irritate the digestive tract and can indirectly cause itching by exacerbating hemorrhoid symptoms. For instance, spicy foods are a common trigger, as they can increase sensitivity in the anal area when passing through the body. Caffeine and alcohol, while enjoyed by many, can also contribute to dehydration, which makes stools harder and more painful to pass. This straining not only worsens hemorrhoid symptoms, but can also increase the chance of an itchy feeling afterward. Reducing intake of these foods may offer some relief, particularly if you've noticed flare-ups after consuming them. Medical conditions beyond hemorrhoids. Now, it's important to remember that hemorrhoids aren't the only reason behind anal itching. Other conditions could be contributing factors as well, which makes it crucial to identify the actual cause of your symptoms. For example, fungal infections, like yeast infections, can develop around the anal area and cause severe itching. Conditions such as eczema or psoriasis can also lead to irritation and itching, affecting the sensitive skin in the region. These conditions may require different treatments than hemorrhoid relief. So if your itching persists, it may be wise to consult a healthcare professional to rule out other causes and receive the appropriate treatment. Uncovering the real reasons behind your itchy anus. As we have understood, hemorrhoids itch and their triggers. Let's reveal the real reasons behind these issues that keep that itch coming back. Inflammation and chronic straining. Did you know that straining on the toilet, even just a few times, can lead to long-term issues that keep you itching? Many people don't realize that every time we strain during a bowel movement, we're placing enormous pressure on the blood vessels around the rectum and anus. This pressure can irritate hemorrhoidal tissue, causing inflammation that's felt not only as pain, but often as an incessant itch. Each time you strain, especially over weeks, months, or even years, this inflammation becomes more chronic, making the itching almost unavoidable. For some, this habit can make hemorrhoids worse, or even lead to new ones forming. Straining often happens as a result of constipation, poor toilet posture, or even spending extended time sitting on the toilet. In fact, a habit many of us are guilty of, scrolling through our phones while sitting on the toilet, could be contributing to the problem. By increasing the amount of time we spend seated, we're also increasing the pressure on the veins in the rectal area, and over time, this can significantly worsen the itching. Constipation and diarrhea. Constipation and diarrhea might seem like opposite issues, but when it comes to hemorrhoid discomfort, they can both contribute heavily to itching. Constipation is one of the primary causes of straining, since hard stools are more difficult to pass. As we strain to eliminate these hard stools, we're essentially forcing the blood vessels in the anal area to bear excessive pressure, leading to irritation and inflammation. On the other hand, diarrhea can also make hemorrhoids worse. When someone experiences frequent loose or watery stools, the skin around the anus can become irritated due to excess moisture and frequent wiping, which further aggravates hemorrhoids. This irritation often leads to itching as the inflamed hemorrhoidal tissue reacts to the constant exposure and friction. Practical tips for bowel health. One of the best ways to prevent constipation and avoid straining is by making fiber a regular part of your diet. Fiber helps to soften stools, making them easier to pass without excessive effort. Foods rich in fiber include fruits, vegetables, whole grains, and legumes. Alongside fiber, staying hydrated is crucial. When you drink enough water, your body is better able to regulate bowel movements, which can reduce the need for straining and protect hemorrhoidal tissues from becoming inflamed. Additionally, establishing regular bowel habits can make a big difference. Try to respond to the natural urge to go, rather than delaying it, and maintain a healthy, upright posture while on the toilet, which can also ease the passage of stools without unnecessary strain. Lifestyle factors. Another often overlooked factor is how much time we spend sitting, especially on hard surfaces. Whether at work or while commuting, long periods of sitting increase pressure on the rectal veins, which contributes to the formation and irritation of hemorrhoids. If your job involves prolonged sitting, try to stand, stretch, or walk for a few minutes every hour to relieve some of the pressure on these veins. Sitting on softer surfaces or using cushions can also help alleviate pressure. Personal hygiene practices. The way you clean yourself can also play a big role in hemorrhoid discomfort and itching. While maintaining cleanliness is essential, using harsh scented products or wiping too aggressively can irritate sensitive skin around the anus. To minimize irritation, opt for gentle, fragrance-free products and consider using hypoallergenic wipes or a bidet, which can be more soothing on inflamed skin than traditional toilet paper. This simple change in hygiene can significantly reduce itching caused by hemorrhoids. Hidden contributors, stress and dehydration. There are some hidden contributors to hemorrhoid-related itching that are often overlooked, such as stress and dehydration. Stress has a known impact on digestive health and can lead to issues like irritable bowel syndrome, IBS, or irregular bowel movements, which can worsen hemorrhoid symptoms. When stressed, some people experience constipation or diarrhea, both of which can aggravate hemorrhoids and lead to itching. Dehydration is another critical factor. Without enough water, stools become harder, increasing the likelihood of straining and causing irritation around hemorrhoidal tissues. By staying hydrated, you're not only aiding digestion, but also helping to prevent constipation and unnecessary straining that can trigger itching. Before going ahead, if you're finding these tips helpful, don't forget to like, share, and subscribe for more health insights. Now, let's dive back into finding lasting relief for hemorrhoid discomfort. Long-term solutions and lifestyle adjustments. So far, you have understood the triggers, real reasons, and some general aspects to handle them. But what's the permanent solution? No, we are not going to suggest some medications. We are going to rectify the real causes with lifestyle adjustments. Let's dive in. Dietary adjustments. The first place to start is with your diet. The foods you eat can have a profound effect on your digestion, stool consistency, and ultimately the health of your hemorrhoidal veins. One of the most important dietary components for hemorrhoid management is fiber. Fiber plays a key role in softening stool, making it easier to pass without straining. When stool passes smoothly, there's less pressure on the veins around the anus, reducing the risk of inflammation and irritation. So, what are some fiber-rich foods to include in your diet? Fruits like apples, pears, and berries are packed with fiber and easy to incorporate into snacks or meals. Vegetables, especially leafy greens like spinach and kale, are also fantastic options. Whole grains, such as oats, brown rice, and quinoa, are excellent sources of fiber and are healthier alternatives to refined carbohydrates. Legumes, including lentils, beans, and chickpeas, are rich in both fiber and protein, making them great for supporting digestive health. Aiming for a balanced intake of these fiber-rich foods daily can do wonders for your digestion and help prevent constipation, which is a major contributor to hemorrhoid issues. Remember, when increasing fiber intake, it's important to do so gradually to avoid digestive discomfort and always pair it with adequate water intake. Exercise and activity. Regular physical activity not only supports overall health, but is also crucial for digestive health. Exercise helps stimulate gut motility, which means it encourages the natural movement of food through your digestive tract, reducing the risk of constipation. This, in turn, decreases the need for straining during bowel movements, a leading cause of hemorrhoid flare-ups. You don't need to engage in intense exercise to see benefits for hemorrhoid health. Even low-impact activities can help. For instance, a simple walk after meals can work wonders for your digestion, keeping things moving smoothly through the system. Light aerobic activities like swimming, cycling, and yoga can also be beneficial as they improve circulation without putting direct pressure on the rectal area. In contrast, heavy lifting or high-impact exercises that strain the abdominal muscles can exacerbate hemorrhoid symptoms. So, be mindful of your exercise choices. Healthy bowel habits. Developing healthy bowel habits is essential for reducing hemorrhoid discomfort. First, aim to establish a routine by going to the bathroom at a consistent time each day, as this can help regulate your body's natural rhythm. Try not to delay going to the toilet when you feel the urge, as holding it in can make stool harder and more difficult to pass, leading to strain. Another helpful habit is using a footstool while sitting on the toilet, which can improve your posture and make the process easier. A footstool elevates your knees, creating a squatting position that aligns the colon for smoother passage of stool, reducing strain on the rectal area. Additionally, avoid prolonged sitting on the toilet. Bring your phone, magazines, or other distractions elsewhere to avoid lingering in the bathroom, which can increase pressure on hemorrhoidal veins. Stress management techniques. Believe it or not, stress can play a big role in digestive health. When we're stressed, our bodies can react by disrupting normal bowel movements, leading to issues like constipation or diarrhea, both of which can aggravate hemorrhoids. Chronic stress can also increase inflammation in the body, further contributing to discomfort. Incorporating relaxation practices into your daily routine can help manage stress levels and support digestive health. Mindfulness techniques, such as meditation and deep breathing exercises, can be incredibly effective. Even just a few minutes a day can make a difference. Another simple method is progressive muscle relaxation, which involves tensing and then slowly relaxing each muscle group in the body, releasing built-up tension. Physical activities like yoga or tai chi are also excellent for reducing stress while promoting physical movement and circulation. Hydration. It is one of the simplest yet most effective changes you can make in your life. Water is essential for digestion and helps to soften stool, making it easier to pass without straining. Dehydration, on the other hand, can lead to hard stools that increase the need to strain during bowel movements, putting more pressure on hemorrhoidal veins. Aim to drink at least 8 glasses of water a day, but keep in mind that your personal needs may vary depending on your activity level, climate, and diet. If you're eating more fiber-rich foods, water intake becomes even more important, as fiber absorbs water to keep stool soft and prevent constipation. To ensure you're staying hydrated, try carrying a water bottle with you throughout the day and sipping regularly. Herbal teas and water-rich foods, like cucumbers and watermelon, can also contribute to your daily hydration needs. Incorporating these long-term solutions into your lifestyle can make a substantial difference in managing hemorrhoid symptoms. By choosing fiber-rich foods, staying active, practicing healthy toilet habits, managing stress, and keeping hydrated, you're setting yourself up for long-term relief and improved overall health. Remember, the key is consistency. Small, steady changes can lead to lasting results, allowing you to feel comfortable and hemorrhoid-free in the long run. Immediate remedies for hemorrhoid relief. When dealing with hemorrhoids, it's natural to seek fast relief from symptoms like pain, itching, and swelling. While long-term lifestyle changes are essential for preventing flare-ups, certain immediate remedies can provide temporary relief and make daily life more comfortable. Let's go through some effective methods you can use right away to ease the discomfort. Topical solutions. One of the most common ways to manage hemorrhoid symptoms is by using over-the-counter, OTC, topical solutions. These creams and ointments are designed to provide temporary relief by reducing inflammation, soothing irritation, and minimizing swelling. Look for products that contain hydrocortisone, which can help reduce itching, or lidocaine, which offers numbing effects for pain relief. Another beneficial ingredient to consider is aloe vera, which has natural soothing properties that can help calm irritated skin around the anus. Witch hazel pads are another popular option. Witch hazel is a natural astringent, meaning it can help tighten and protect the skin while reducing inflammation. Many people find that gently applying a witch hazel pad to the affected area provides a cooling sensation and immediate relief from itching and discomfort. Make sure to choose unscented, alcohol-free witch hazel pads, as additional ingredients can irritate sensitive skin. If swelling is a major concern, applying a cold compress or ice pack to the affected area can be incredibly effective. The cold constricts blood vessels, reducing inflammation and temporarily numbing the area to relieve pain. Wrap the ice pack in a soft cloth or towel to prevent direct contact with the skin and apply for 10 to 15 minutes at a time. Repeat as needed, allowing time between applications for the skin to warm up and recover. Soothing baths. For those dealing with ongoing discomfort, a warm sitz bath can be a simple but powerful remedy. A sitz bath involves soaking only the hip and buttocks area in warm water, which can help relax the muscles, soothe inflammation, and relieve itching. The warm water improves blood flow to the area, which can aid in healing and reduce the pressure on hemorrhoidal veins. To take a sitz bath, fill a clean bathtub with a few inches of warm water, or use a specialized sitz bath basin that fits over your toilet seat. Soak in the warm water for 15-20 minutes, ideally after bowel movements or whenever you're experiencing discomfort. You can add Epsom salts to the water, which are known for their anti-inflammatory and soothing properties, or even a few drops of lavender oil, which may enhance relaxation. Just be sure to avoid any harsh soaps or bubble baths that could irritate the skin further. Gentle cleaning techniques. Maintaining good hygiene is key to managing hemorrhoid symptoms, but it's essential to be gentle. Many people make the mistake of using harsh toilet paper or wipes that contain fragrance and other irritants which can further inflame hemorrhoidal tissue. Opt for soft, hypoallergenic toilet paper and avoid rubbing vigorously. If possible, consider using moistened hypoallergenic wipes instead of traditional toilet paper. Look for unscented, alcohol-free wipes specifically formulated for sensitive skin. Alternatively, a bidet or handheld shower sprayer can be even gentler, offering a water rinse to clean the area without any contact that might aggravate itching or swelling. After rinsing, gently pat the area dry with a soft cloth or towel rather than rubbing, which could irritate sensitive skin. When to seek medical advice. While many hemorrhoid symptoms can be managed at home, there are situations when it's crucial to seek medical advice. Hemorrhoids can sometimes indicate other health issues, and persistent or severe symptoms shouldn't be ignored. Knowing the warning signs that warrant a doctor's visit can make a significant difference in both treatment and peace of mind. Warning signs. If you experience severe pain or bleeding from the rectum, it's important to consult a doctor. While some minor bleeding during bowel movements is common with hemorrhoids, heavy bleeding or blood that appears without bowel movements may be a sign of a more serious condition, such as a fissure, infection, or even colorectal cancer. Another concerning symptom is the presence of lumps around the anus. While external hemorrhoids can form lumps due to swelling, Lumps that don't go away, feel unusually hard, or continue to grow should be examined by a healthcare provider to rule out other issues. Also, if you notice a discharge of mucus or pus, or if there's a foul odor that accompanies anal discomfort, this could indicate an infection or abscess that requires immediate medical treatment. Persistent itching that doesn't improve with home remedies can also be a sign of an underlying condition, especially if it's accompanied by other symptoms like swelling, rashes, or discoloration. If you've been dealing with itching, you now have the tools to tackle it head on. We've covered a lot today, from understanding the common triggers behind that uncomfortable itch to practical lifestyle changes that can make a real difference. Remember, it's all about small, sustainable steps. Eating fiber-rich foods, staying active, managing stress, and, most importantly, listening to your body's signals. Relief is possible, and by making just a few adjustments, you're already on your way to living itch-free and comfortably. Don't let this issue control your life. Take charge and start feeling better today. If you found this information helpful, please hit the like button, subscribe for more videos on health and wellness, and share this video with anyone who might benefit. Together, we can help more people find relief. Thank you for watching, and take care of your health.